1 in 5 children in East Sussex are overweight or obese by the time they reach school. So we recognise the need to intervene earlier in order to develop positive, healthy eating and physical activity habits in children and their families.
We decided that part of our overall budget we'd want to invest in that. We've looked really carefully at where we invest to really maximise our impact, and as part of that the nursery grants are something that we think bring a lot of benefit to children, to communities and overall to fitter, healthier, happier people.
The funding for the Nursery Grants Programme has come from East Sussex County Council Public Health, as well as Eastbourne, Hailsham and Seaford CCG and Hastings and Rother CCG. This has provided the opportunity for every private and maintained nursery within those CCG areas to apply for a £5,000 nursery grant to be used to fund evidence-based activities to address childhood obesity. Early years is a priority area for both the County Council and CCGs as part of our East Sussex Better Together programme.
We worked with our public health colleagues to really identify the few programmes that we were going to offer, because we wanted them to be evidence-based, we wanted them to be able to show an impact, and we wanted programmes that would leave a legacy. One of which, for example, is Early Movers, that really works to increase physical activity for children and those that work with them.
I've seen staff members come away very enthusiastic as a result of doing the Early Movers training, and they come up with their own creative solutions to get children more active, and they feel so much more confident to communicate with parents and families and with children about how to get more active.
We've always been quite enthusiastic about physical activity in general. We've been involved with the Nursery Grants Programme. It enabled us to get training for our practitioners, so they've done a broad spectrum of training. The Early Movers training was about teaching the practitioners activities they could do, provide them with an understanding of the importance of physical activity for children.
The course has changed every aspect of how we are here.
We're definitely encouraging more physical activity in the nursery.
We've got a lot of support to be part of the nursery grant, so they allocate a coordinator who does support you in your setting, so you're constantly reflecting on your own practice and you've got somebody there supporting you to do that.
The evaluation of the Early Movers training has shown that it's had a real positive impact on our nurseries and our early years practitioners. It's had a significant impact on awareness and understanding of the early years physical activity guidelines, and has provided nursery practitioners with knowledge, skills and confidence in which to be able to create physical activity environments for the children they work with.
Children are more confident, are fitter, are more active. Children are actually visibly changing, but so too are families.
The parents have a greater understanding of the importance of physical activity, and we're seeing happier, healthier and more physically active children. And at the end of the day, that's what the training's all about.
The Nursery Grant Programme is really beneficial to ourselves and other practitioners. It's because we can share good practice. It provides some really rich learning experiences for our practitioners, and that will feed through to the experiences we provide for our children and experiences that parents can receive as well.
We've also seen nurseries grant expenditure activities such as training and resources and the delivery of different types of programmes specifically referenced in their Ofsted inspection reports, which has been fantastic to see.
I think I would recommend that other areas look at what we're doing to get children the very best start in life. Investing in early years is the way to do it. This is a programme with muscle, with impact, and it does make a difference.